Good afternoon, thanks for joining us. I'll start with the statistics for today, as usual. First of all, the total number of positive cases reported yesterday was 717. That represents 8.3% of the total number of tests carried out and means that the total number of confirmed cases is now 82,011. I should say, though, although we often see a slightly lower number of new cases reported after a weekend, today's figure is nevertheless still lower than we would have expected it to be. So we are looking to see whether there are any other reasons that might be the cause of that. And if that is the case, we'll obviously update you as appropriate. 220 of the new cases were in Greater Glasgow and Clyde, 136 in Lanarkshire and 101 in Lothian. The remaining cases were across 9 other health board areas. I can confirm that 1,227 people are currently in hospital, which is a decrease of 14 from yesterday, and 98 people are in intensive care. That's 2 fewer than yesterday. I unfortunately have to report that an additional 6 deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. Again, I would remind you that registration offices tend to be closed at weekends, so the figures we report for deaths on Sundays and Mondays can be artificially low as a result. However, 36 deaths were reported on Saturday, and taking account of the 6 that have been reported in the past 24 hours, the total now stands at 3,286. And my condolences once again to go to all those who have lost a loved one. I'm joined today by the Health Secretary and the Chief Medical Officer. Before handing over to the Health Secretary and then the 3 of us taking questions, there are 3 issues that I want to very briefly update you on. The first relates to some additional support that we are providing for care homes. We have confirmed funding today that will help to provide every care home in Scotland with 1 or 2 iPads. This will enable more than 1,400 care homes to help their residents stay connected with family and friends while visiting remains restricted. It will also help clinicians such as GPs or speech and language therapists with remote consultations when that is necessary. That will allow them to assess residents' health conditions without always needing to visit in person. Now, I should stress, and I really do want to make this point very strongly, the iPads are not intended to be a substitute for personal visits to care homes. We know and understand how vital in-person visits are, both for residents and for their family members. For that reason, we are currently finalising our plans to ensure that routine visits from designated visitors can take place as safely as possible. As we've indicated before, these plans will include regular testing of care home visitors, and the Health Secretary will set out further details soon, probably in a statement to Parliament next week. However, this funding will give care home residents an additional way of keeping in touch with family and friends and of receiving expert clinical advice. Second point I want to highlight relates to our plans to develop regional testing hubs to further increase NHS Scotland's testing capacity. We said before that NHS Scotland is currently developing 3 new testing hubs in Aberdeen, Edinburgh and Glasgow. There was some press speculation over the weekend about possible delays to these hubs, so I want to take the opportunity today to stress that all 3 of them are on track to open before the end of this year. As we speak, building work is being carried out and recruitment is taking place. These will enable NHS Scotland to process a further 22,000 tests a day, and of course they form an important part of our plans to increase daily testing capacity for Scotland overall to at least 65,000 by the end of the year. And amongst other things, these hubs will be able then to ensure that the NHS in Scotland processes all of our routine care home testing, which will help to ensure that we get these test results back as quickly as possible. These efforts to increase capacity within NHS Scotland are, of course, in addition to and entirely compatible with the ongoing work led by the UK Government to increase UK-wide testing capacity. We very much welcome the announcement today that the UK plans to establish a major new testing laboratory in Scotland early next year, which might be able to handle up to 300,000 tests a day from across the UK. We're working constructively with the UK Government in order to help with the establishment of that laboratory. Now, the final issue that I want to highlight today is that we will confirm the outcome of our weekly review of COVID levels of restriction tomorrow. As I've mentioned before, one of the issues we're looking at very closely is whether current restrictions are reducing COVID rates quickly enough in some areas, particularly in parts of the west of Scotland. These areas that have stable but still stubbornly high prevalence of the virus. And stubbornly high prevalence causes us concern for a number of reasons, two in particular that I want to highlight just now. Firstly, it means that we don't have enough assurance, or as much assurance as we would want to have, that our hospital and intensive care services are able to cope as we go deeper into the winter. We know that winter always brings additional pressures on the NHS, and ensuring that it can cope with those pressures as well as COVID is absolutely crucial. And that's why regional hospital and intensive care capacity are important factors in our decision making when we consider what level of restrictions will be assigned to each area. The second reason I want to highlight is this one. Stubbornly high prevalence means that we might have less flexibility to offer some limited and careful easing of restrictions over the Christmas period, which we are very keen to do, and I'm sure all of you are very keen for us to do as well. So moving to level 4 restrictions for a limited period in some areas, while not a decision we'll ever take lightly because of the wider economic and social impacts, would help us to address both of these concerns. More generally, and this is something we should all bear in mind at any level of restrictions, especially as we all get more and more fed up of them, is that every time we stop someone, especially someone who is older or more vulnerable, becoming infected with COVID, we give them the chance of living into the era, which is now firmly on the horizon, when better therapies, vaccines, testing and treatments will be available. And I think that motivation for all of us as we are living under these restrictions right now is important to bear in mind. The end is not quite with us, but we can see hope on the horizon now that perhaps we couldn't just a few weeks ago. So these issues are ones that we're currently considering very closely, especially in relation to Lanarkshire, Glasgow and some surrounding parts of the west of Scotland. The Government's final decision will be taken by the Cabinet tomorrow morning, and then I will set that out to Parliament tomorrow afternoon. However, and finally, it remains the case that all of us have a part to play in suppressing the virus to the lowest possible level. And that means sticking to both the letter and the spirit of the rules and guidance in place in your area at any given time. Every time one of us breaches these rules or tries to put our own twist on them, tempting though I know that is, we do put others at risk and we undermine the overall effectiveness of what we are seeking to do. So let me close by just reminding everybody what is being asked of all of us right now. If you live in a level 3 area, please don't travel outside your local authority unless for an essential purpose. If you live elsewhere in Scotland, please do not travel into a level 3 area, again, unless it is essential, and please don't travel outside Scotland just now unless essential. Now, you can find what we mean by essential on the Scottish Government website, but I am talking about things like childcare or looking after a vulnerable person, or if you have to travel a short distance for essential shopping that is not available in your local area. Secondly, unless you live in Orkney, Shetland or the Western Isles, please do not visit each other's houses just now, except for purposes like childcare or looking after a vulnerable person. When we're meeting people from other households, outdoors or in a cafe, for example, stick to the limit of 6 people from a maximum of 2 households. Avoid car sharing if you possibly can, work from home when you can, and if you can, download the Protect Scotland app. And finally, remember facts, and don't just remember them, remember to apply the rules encapsulated in the facts advice, because it is basic but really important stuff to try to minimise the risks of transmitting the virus. So remember to wear face coverings when you're out and about, avoid crowded places, clean your hands regularly, clean any hard surfaces that you're touching, keep 2 metres distance from people in other households if you're outdoors or in a cafe, and self-isolate and get tested if you have any of the symptoms of COVID. These rules do help us to protect ourselves, they help us to keep our loved ones safe, they help us to protect our wider community, to protect the NHS, which is so important, and also ultimately they help us collectively save lives. So my thanks again to everyone who is working so hard to make sure that these rules are adhered to. I'm going to hand over now to Jeane Freeman, the Health Secretary, and then she, Gregor and I will take questions as usual.
Thanks, First Minister. As you know, in the first phase of the pandemic, we continued to treat urgent emergency and trauma patients, but we paused a great deal of healthcare. That was a very difficult, but at the time necessary decision, which I know left many people waiting longer for elective care than they or we would want. Now, as we continue to deal with COVID-19 cases in our hospitals and in ICU, we're working to maintain as much non-COVID healthcare as we safely can. That is inevitably affected by the differing levels of the virus across the country. So we have to give our clinical teams the flexibility to manage the demands on them in the current emergency situation, and we have to give patients clarity about what they can expect. So with leadership from our Deputy Chief Medical Officer and senior clinical representation, we've developed a national framework for the clinical prioritisation of elective care, and today we're publishing that framework. The framework gives our NHS boards clear guidance for clinically prioritising care, which then determines the timeframe within which patients will be seen and treated, making sure that those with the greatest clinical need are treated quickest. Using the framework will also ensure that patients are given a clear and realistic expectation of when they will receive their treatment, and we will take steps to make sure that patients receive clear and timely communication for their own planned procedure. We will always want to treat patients in the quickest period possible. Right now, our NHS has to balance being able to do that alongside responding to the hospital and ICU admissions from COVID cases. Clinically prioritising patient cases for planned procedures is the safest and the fairest way of making sure that those with the greatest clinical need are treated quickest. Thank you.
Thanks, Jeane. We'll move now straight to questions. Firstly, Gordon Cree from STV.
Thank you, First Minister. We've spoken this morning to the leader of East Dunbartonshire Council, who's concerned about the potential economic impact if the area went into Tier 4, but interestingly also said his view was that if Tier 4 was required, it should have happened weeks ago. Now, given that you've said the figures for much of the west of Scotland are stubbornly high, that there is some merit to that argument, isn't there? And could you also give us an indication, if you can, of how wide an area is under consideration for Tier 4? There have been some reports that it could be up to 12 councils.
Look, these are always careful judgments that we have to reach. I may be corrected if I'm wrong here, so I apologise in advance if I am. I'm not aware that East Dunbartonshire Council has been making that case to the Scottish Government directly over the past few weeks, that they should be moved to level 4, but if I'm wrong about that, I apologise. We try to assign levels based on the extent of restrictions that we think are required, taking account of the prevalence, the test positivity, the pressure on NHS resources, and of course the direction of travel. And actually, just as a reflection, I think most of the criticism that has been made of the Scottish Government in recent weeks has been that we are applying restrictions that are too onerous, not that we are not applying restrictions that are onerous enough. Now, you know, people are perfectly entitled to question and scrutinise. So you will always get those opinions from both directions. And, you know, the job of government, which is, you know, not an easy job at the moment, and not one that any of us relish, but it is our responsibility to try to balance all of these factors and take a decision. In terms of the economic and social impact, of course, we are all concerned about that, which is why we don't take decisions about increasing restrictions and certainly not going to the level 4 tier of restrictions lightly. But we've also got to remember that there can be, I think, a bit of a fallacy at play here. And I understand why people think that if we just don't have restrictions to control the virus, then the economy will be fine. It doesn't work that way, because if we don't control the virus, then the damage to the economy will actually be worse. But as part of any decisions, of course, we will set out the ongoing economic and business support that we will make available. And finally, in terms of potential geographic scope, as I said, we will be considering the latest data this afternoon. Cabinet will take a decision tomorrow morning, and then I'll set it out to Parliament. But we are talking the west of Scotland in particular. I think the areas that have that give us, I suppose, most concern, not because they're deteriorating, because the positions are actually quite stable, but because they're not reducing sufficiently, would be the council areas within the Greater Glasgow and Clyde Health Board, possibly with the exception of Inverclyde and North and South Lanarkshire. And I don't think that will come as any surprise. Clearly, there are some other councils around that, Ayrshire, for example, West Lothian, maybe at the other side, that we're looking at, but perhaps not as clear-cut a case there. But these will be decisions that we are considering over the course of today. And I've set out the reasons why. If we do take the decision to put any areas into level 4, that would be taken, and we'll continue to try to be as proportionate as possible. The final point to make, and again, let me preface this by saying we haven't taken decisions, we'll also be looking to see whether there are any parts of the country that should go down a level, where prevalence of the virus has fallen sufficiently and we are satisfied enough about the sustainability of that. So this is not, I know it feels like it at the moment, it's not a one-way street. We don't want it to be seen as a one-way street. We want to be giving as much consideration to whether we can ease restrictions in a particular area as we give to whether we need to tighten them up. Do you want to add anything, Gregor?
I think all I would add just now is that across the country, as we've been charting the last few weeks, what we have seen is we've spoken about it before, these encouraging signs of progress that we've made across many of the different areas. And when we look at the data that we analyse on a regular basis, the R number across Scotland now has reduced to between 0.8 and 1.1. That is real progress. Growth rate is somewhere between -4% and +1% now. So we've no doubt about it, the actions that people have taken, particularly in some of these areas with more concentrated disease activity, have led us to make this type of progress. But we can't get away from the fact that that progress appears to have slowed quite significantly in some of those areas. And if we were to leave that unchecked, there is the possibility that we will see a re-emergence of this as we get into the deeper winter, and that re-emergence might have greater effects and accelerating as we approach the kind of deeper winter period, when perhaps people are more likely to come together indoors.
Peter Whitman from ITV Border.
Thank you, First Minister. First Minister, given from what you've said and what your Health Secretary has said, it's pretty clear that for some time yet, Scotland will be, first of all, dealing with COVID. There'll be a backlog in the NHS, which has to be dealt with. Hopefully, the rolling out of a vaccine, and some severe economic consequences also to deal with next year. Is it also your policy, as articulated by your Westminster Party leader, Ian Blackford, that next year, 2021, an independence referendum should take place?
Look, I think my views on independence are well known. This is not the forum for me to go into them in detail. When we get to the point where we're sending out plans and manifesto for the election, I'll set out my thoughts on the timing of that. I've made that clear, but I'm not getting any further into that today. This is a COVID briefing. Can I say that you can ask me again if you want? My answer will probably be the same.
Well, I was just saying, with respect, your Westminster leader has raised this. He's your leader at Westminster. It's not in the national newspaper.
I don't think it is. I don't think it should come as any surprise to anybody that people in the SNP want to think there'll be an independence referendum sooner rather than later. That is probably the view of all of us. But I'll set out as First Minister, as leader of the SNP, when we set out our manifesto, what the timing of that is. But I'm not going to be diverted from a COVID briefing today into other matters, no matter how much I know you might like me to, and how much some people watching might like me to, but I think most people watching probably want to hear my thoughts on COVID. What you say is right. Scotland, but not just Scotland, the UK, Europe, the world will be dealing for the next period with COVID. We'll then hopefully be dealing with a position which is about recovery from COVID, and that very much includes, we've got more good news on the vaccine front today, that will include the rollout of a vaccine. So I think we are at the point where we can, we've got a difficult few months ahead of us in common with other countries, but I think we are at the point now where we can start to see the hope on the horizon. And of course, it's natural for a country like Scotland to ask itself, as it starts to build a recovery from COVID, how it best equips itself to do that with the powers at its disposal. And I'm sure that will be a healthy part of the discussion that we have in Scotland as we go up to and through the Scottish election next May. David Henderson from the BBC.
Thank you, First Minister. If areas are moved into level 4, what's the exit strategy? On what basis do they get back out again? And can we be sure that this will be before Christmas? And one of the key level 4 restrictions in your plan is the closure of all but essential shops. Is this really necessary, bearing in mind that a recent SAGE paper and a Welsh Government report both said this would have low impact on COVID transmission?
You have to look at, when you're trying to restrict the transmission of a virus, you have to look at restricting interactions. We are already asking people not to meet indoors in their own homes. That's the law. We have restricted hospitality to a large extent. So if you want to bear down further on the virus, you have to look at the other areas where people come together. And retail is one of those. That's why it is in the top level of restrictions. As we've heard already in the questioning today, there will be some people who think that goes too far. There'll be some people who think it doesn't go far enough, or we should have done it before. We have to reach balanced judgments on this. And, you know, we need to remember that at the heart of, and all of us want to see the economy recover as quickly and as sustainably as possible. But if we have the virus at too high a level, then that is more difficult to do than it is if we get the virus firmly under control. So these are not easy decisions, but they are inevitable and essential decisions that face all governments right now. Non-essential retail is closed right across England right now. Wales has just come out of a period where non-essential retail has been completely closed. The Republic of Ireland, non-essential retail, I think, is still completely closed. We have managed to avoid that so far. I hope we will still avoid that in large parts of the country. But where we have stubbornly high prevalence, if we want to protect our NHS and if we want to get to a point at Christmas where we might be able to look forward to a bit of easing of restrictions, albeit that we'll have to be very careful, then we need to get that prevalence down more right now. In terms of exit strategy, one of the factors here is that in order for parts of the country to go down to, say, level 2 or level 1, perhaps it is necessary to have a period in level 4. That is not true of all parts of Scotland. But, you know, there is a judgment to be made about, do you want a very long period in level 3, or do you want to try and shorten the period in level 3 by having a short period in level 4? So I appreciate these are difficult decisions for those taking them, but they are more difficult for those living with them. But we don't do anything that we don't think is necessary and justified, which is why we have this very careful process that we go through. Alan Smith from Bauer.
Thanks, First Minister. A question in regards to schools. Just looking for your response to the EIS union, which is calling for a rethink on your school stance. Last week it warned moving to level 4 while keeping schools fully open will heighten concerns over school safety, which could prompt consideration of industrial action. If we do see this move to level 4 in those areas, will schools definitely remain open?
That is my objective and intention. We don't take lightly issues of school safety, young people's safety, teachers and other people working in schools lightly at all. I'll ask Gregor in a moment to say a bit about what the evidence tells us in terms of transmission in schools, or the relative lack of transmission in schools, not that it is non-existent. But again, sometimes, it's about which way round we see these things. Yeah, you can say, well, if you have to go to level 4, then schools should close. Actually, we come at it from the other way. Sometimes we are asking people, adults, those of us grown-ups, to bear a few more restrictions in order that we can keep the virus at levels where we're able to keep schools open. Why? Because we know that it does damage to young people not to be in normal schooling. Young people have had months out of school already this year, and if we can at all avoid it, we want to ensure that they don't have further time out of normal full-time schooling. So actually keeping schools open is part of our overall consideration here.
The first thing I'm going to say is that we can be confident with the evidence that suggests that keeping schools open has a very strong public health benefit for children and young people, both in terms of allowing them to pursue their educational opportunities, but also some of the benefits that it has on particularly the mental health, but also physical health as well. Of course, we should continue to examine the data that sits around about schools, because we need to make sure that they remain safe to maintain that, and we do that through a variety of different means. The data does tell us that actually everything that we see there is that schools are not an environment where there is extensive transmission to any extent. In fact, ONS data suggests that teachers, people who work within schools, are no more likely to become infected than people of a similar age in other occupations as well. That's the first starting point. We've also looked very closely at the proportion of people who have named education as their employment when they've been talking to Test and Protect since schools returned in August. And again, that has remained constant. So we are not seeing evidence of any significant increased risk with transmission, particularly amongst adults within schools. And when we look at the evidence for children, again, what we can say is that particularly for the younger age groups, there is no compelling evidence at all of significant transmission between those age groups. There is more evidence as children gets older, but even those in those children, it tends to be at a relatively lower level than in adults. We will continue to track this. We will continue to keep an eye on it. We must be aware that, of course, that schools are not the only place that children and young people interact. We must take that into account as well. But at this moment in time, there's nothing to suggest in the data that there is any impact on safety in schools by their return.
Jack Foster from Global.
Good afternoon, First Minister. As parts of Scotland are facing the possibility of Tier 4 restrictions, do you sympathise with hospitality businesses and staff in the Central Belt particularly who've said that when they were forced to close, they weren't the source of COVID infections and increased transmission? And now, over a month later, the situation has apparently gotten worse and not better. And alongside that, as we head towards Christmas, and great efforts seem to be underway to ensure that shops and the economy will be able to continue to trade in the run-up to Christmas, understandably. How do you square that with the continued closure of hospitality at a time of year where loneliness is notoriously exacerbated and where many, particularly older people's only social interaction is perhaps a few pints in their local pub? Why is it that these places and these people are seemingly of less value in this than Christmas shopping and keeping the economy open and revenue to shops?
I'm kind of not sure where to start with that. It's about trying to stop old people getting this virus and dying from it that is the main driving objective of everything we're doing right now, so that older people are alive into next year and into the part of next year, hopefully, when we see vaccines and treatments ride to the rescue here. So the idea that we're not valuing people, particularly people in that category, is just couldn't be further from the truth. In terms of, and I don't want to get ahead of ourselves here because there's lots of consideration and discussion, not least across the 4 nations of the UK right now before we get to a settled point for Christmas. But if you're asking me my priority for Christmas, it's to allow families some ability to get together. That should be the priority, and that's if we do go to level 4, for any areas tomorrow, then part of it, not the whole reason, but part of the reason is to try to get prevalence down to the point where we think we can have some limited easing around that. More broadly, I have sympathy for everybody, individuals, businesses, everybody who's affected by this right now. Nobody is escaping this, and some are carrying a bigger burden than others. My greatest sympathy goes to those who are bereaved because of the virus, the many people across the country that are suffering long-term health implications, those working day in and day out on the front line of our National Health Service, treating COVID patients. So, yes, businesses are having a really tough time, but we don't do businesses any favours if we take our foot off the COVID brake and allow the infection to spread again, because that will mean even longer lasting pain for the economy. I would say, finally, you used a phrase there about getting worse. Things are not getting worse in Scotland. On the contrary, we're actually seeing a stabilisation and perhaps a slight improvement nationwide that masks some regional variation. But even in the areas that we are concerned about right now, they are not getting worse. They are just not getting better as fast as we need to see them get better. But without these restrictions, be in no doubt, we would be looking at prevalence and probably hospital admissions, ICU admissions and deaths that are much higher than we are looking at right now. We were on a trajectory back when these restrictions, household and hospitality restrictions were introduced. We were on a trajectory that was probably leading to around now about 3,000 cases per day. Clearly we're not at that, and that is because of these restrictions. And my final point here is that almost, and I don't mean this in any way as a criticism, because I totally understand the place it comes from, but literally every conversation I have with businesses or those representing economic interests more generally, I'm met with but it's not us that are spreading the virus. The virus is spreading, it has been spreading, we know it's spread, so we can't be absolutely sure exactly where people get the virus until we do genomic sequencing. But what we do know are the conditions in which this virus is most likely to spread. We know the kind of conditions in aspects of hospitality where with the best will in the world it can be difficult to restrain the virus, and we know what information we get through Test and Protect, and we have to make judgments about how we best limit it. And fundamentally, while we talk about the science and the evidence, fundamentally, this is a virus that spreads because people get together. If we want to stop it spreading, we've got to try and stop people getting together. And that is really, really hard for all of us. But it is just the basic science at the heart of all of this. But nobody should think right now that things are getting worse. Scotland's got the lowest prevalence of all of the 4 UK nations right now. We've got a stable position, slightly improved in many parts of the country. But if we want to protect the NHS and get hopefully a little bit of easing up over Christmas, there are parts of the country where stable is not good enough because it is at too high a level, and that's a decision we face over the next 24 hours. Can I add?
Yeah, there's a couple of things I'd quite like to add in here just now, because when we look at some of the, again, going back to the data, what do we know? What's it telling us just now? When I look at the data for the number of contacts that people have had over the last couple of weeks, there's some warning signs there for me. So contacts have gone up 15% over the last couple of weeks. That's more opportunities for this virus to spread between people. And when the contact tracers speak to individuals, when they do their interviews with positive cases, some of the data that's coming out of that just now tell us that actually the number of contacts that some of those people who are testing positive have with other people are still stubbornly high. And they're higher than perhaps other parts of the UK as well. And that should act as a warning for us. The last thing I would say about this as well is we've been very successful, I think, in getting messages across with the Facts campaign for several months now. But one thing I would want to emphasise to everybody just now is that although facts is very important and we all instinctively think about the F and the face coverings, the other elements of it are equally important. So making sure that we continue to observe that distancing between people, that we're cleaning our hands, surfaces run about us regularly, making sure that we're avoiding crowded places as well. That's just as important, if not more important, than you wearing the face coverings. My concern is that sometimes when I see people interacting with others, is that the thought that they have a face covering on is a protection in itself and is enough. Please, don't assume that. make sure that you're observing these other measures as well. They're really, really important. And perhaps all of us just need to strengthen our resolve again, just to make sure that all of those are just built into the way that we interact with each other now.
Tom Eden from PA.
Thank you, First Minister. Good afternoon to you all. Firstly, First Minister, you addressed it in your answer to Gordon Cree, how you're not going to make a decision about the restrictions until tomorrow with more evidence to be looked at. But over the weekend, well, since Friday, the Deputy First Minister has said that I think initially more restrictions were likely, then they were not inevitable, and now he's been telling councils that they're highly possible. I was just wondering what your take on this sort of speculation or fueling of speculation was, and if it was encouraged or where you stood. And to the Health Secretary, if I may, back in March, Freedom of Information requests to the Ferret suggest you wanted to stop FOIs to local government and the NHS. That didn't happen, but have you seen any examples or got any evidence of whether having Freedom of Information requests available has hindered the coronavirus response?
I'll hand over to Jeane in a second on the second question. Look, Tom, I'm going to be pretty blunt with you here. I've got a choice and the government has a choice. We can take a vow of silence and consult with nobody in taking these decisions, and I can stand up in Parliament tomorrow out the blue and tell people what the decisions are. And local authorities, health boards, businesses can just, basically wait with no discussion or insight into our thought process. If I did that, I'm pretty sure I would get lambasted rightly for not consulting those who need to be consulted. So what we choose to do is consult local authorities. Sometimes the information of that leaks out of these discussions, and that's just the nature of things. There's no point in complaining about that. And I also try to stand here day after day and sort of give people an insight into the issues we're grappling with, so that when I do stand up in Parliament and say what the outcome of these discussions is and what the decisions are, people have got some understanding of why we've got to that point and what the factors are and what the reasons are, and an understanding that we're not taking these decisions lightly. So, you can take your pick as to which approach you prefer. The first approach would probably mean there was no speculation, but it would mean nobody would have any idea what we were doing or why we were doing it until we announced it. And I don't think that would be particularly sensible. Or we can do what we do and accept that that does lead to some speculation, but hopefully it's informed speculation that gives people a deeper understanding. What we don't do, which some other governments do, is kind of brief one newspaper a tidbit or another newspaper a tidbit, and you all know we don't do that on the general direction of travel here. But I think being as open as we can be about the complexities of this and the factors that drive our decision making, I think has stood us in reasonably good stead. And incidentally, on the Deputy First Minister's comments, saying something is likely but not inevitable, these two things are not contradictory. Nothing is inevitable, but you can have something that's not inevitable but still quite likely. And I think it is likely that we will see some areas go to level 4 this week. But is it inevitable until we've taken that final decision? No, of course it's not. So people, even politicians, unless you want us to express ourselves like robots all the time. Sometimes we express things in different ways, but actually when you take a step back and look at it, we're not saying anything different in substance to what we had said before. So I'm going to choose to continue to be as open and discursive as I can about these decisions rather than take that vow of silence and just pronounce them from on high, because I think on balance it's probably the better way to do it.
So if you take yourself back to March, in March, all the evidence that we had, all the indications, what we were seeing on our television screens was a worst-case scenario about the numbers of hospital admissions and demand on ICU that we had to plan for the NHS to expect. My job as the Health Secretary, in the face of all of that, is to look very, very closely at everything we do in the NHS and decide what is absolutely critical to making sure we can respond to that pandemic and what do we have to stop doing. I've already said in this briefing we stopped a lot of important healthcare in order to let us do that. FOI requests are important. Transparency in providing that information, of course, is really important, but it does take a degree of people's time, quite a significant degree in some instances. I'm not being critical of that, it's simply a fact. We had to redeploy NHS staff away from jobs that they were doing to help the front line or to be on the front line. Now, my job as the Health Secretary is to say inside government, here's what the NHS needs, here's what I need to happen. We're a collective government, and that response then is looked at against all the other responses that come from inside government, and the decision is finally taken. I think that my view was the right view as I was taking a lot of decisions, including stopping healthcare for people, as we got ready to face what we anticipated on the basis of the evidence was coming our way. I couldn't be prouder of the fact that the NHS responded the way it did, and we got through those first phases, and we'll get through the next ones too.
It's easy to forget, right? The last 8 months have been horrendous for people across the country and for the health service, but it is easy to forget, and maybe it's a good thing that our memories fade around this, to forget what we thought we could be facing back in February, March. We were looking, and remember, our televisions at that point were full of pictures of hospitals in Italy being unable to treat all of the people that needed to be treated. We were facing the prospect. I will never forget the fear and anxiety of back then, that our health service would not be able to treat everybody who needed it, that there wouldn't be enough beds, enough ICU, ventilators. That's what we were facing. And all of us were just thinking and focused, how do we protect as much as we can every available resource we've got in the NHS to treat people who need it? So criticise the decisions, by all means, that is perfectly legitimate and understandable. But don't see it through the prism of now. Just remember how difficult things were looking that they might be back then, and we were all trying to do our best to make sure that the health service could cope. Paul Mallock from the Courier.
Good afternoon, First Minister. Pleas from businesses and even scientists to not place Aberdeenshire into the level 3 restrictions that might be considered following the Deputy First Minister's briefing on Friday were reported this morning. Is there any chance the government would consider hyper-localised restrictions in areas where there's a flare-up in infections, which would allow other swathes of that same local authority area, like Aberdeenshire, which is so large, to remain in its current level?
We've always said that we would never rule out or turn our face completely against having tiers applying or levels applying at different parts of local authorities, but we have to be careful about that. I think the level system, for as long as we can have a situation where we don't have to have one size fits all across the country, we should try to do that. But the further down we go geographically, the more difficult it becomes for that to hang together, because as I've said before, one of the things that is essential in making that targeted, varied geographical approach possible are travel restrictions. So you know it just becomes a bit more practically difficult to have one level at one part of a local authority and another at another part. It's maybe less impractical in some of our more rural and remote areas than it would be in Glasgow or Edinburgh, for example, but it still brings practical difficulties. What we will always do, so if you have an outbreak, say as we did in Tayside a few months ago in the food processing factory, the Two Sisters outbreak, you put particular measures around it to try to control it. So you may well have different approaches that are driven by outbreaks in different parts of a local authority area. But I think we have to be, while not ruling it out, I think we have to be cautious about subdividing local authority areas too much. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Back on the 7th of October, you made a statement to Parliament announcing restrictions on hospitality, which you said, and I'm quoting, were designed to reduce the likelihood of a future lockdown. You said these new restrictions are intended to last for 16 days. They're intended to be a short, sharp action to arrest a worrying increase in infection. Now, that speech was given 40 days ago today. What assurances can you offer the sector that any increase into level 4 will be a short period of time, and we won't see any sort of creep into a longer period as we saw with this? And can you roll out the level 4 restrictions lasting more than a month?
I'll set out the decisions tomorrow. Level 4 is intended to be for a short period of time. Simon, maybe just have a look around the UK right now. Have a look around Europe. You know, every single country is trying to keep this virus under control. England is in a complete, full national lockdown. I still really hope we will avoid that in Scotland. And also the restrictions that you talked about me announcing on the 7th of October, they have avoided a massive spiralling in infection. Back then, we were on a trajectory, I think I said this a moment ago, we were on a trajectory that by now would have seen us on 3,000 cases a day. We are nowhere near that. So these restrictions have worked. There are some parts of the country now where hospitality is pretty much open, if not completely normally, then apart from the 10:30 sort of closing time, then and with social distancing, etc., then pretty much normally. So we have made progress. We're seeing parts of the country that are making more progress than others, but we've got these parts, the most populated part of the country, where we have stabilised things, but we need to get it down a bit further. So I don't underestimate how difficult that is for businesses affected and for people who are fed up with all of this. But I do still want to try, if I can, us avoiding, more severe measures, one size fits all right across the country. I can't guarantee that, but that's what we're seeking to do. But nobody should think that we haven't made progress as a result of these restrictions. We have. We just need in some parts of the country to make more progress and to make it a bit more quickly if we want to make sure our hospital services can cope in these areas over the winter, and if we do want to get that careful, limited easing up over the Christmas period, which I think we all want to see. But we have to be careful about that. Gregor and I were looking this morning at some figures from Canada, not nationally across Canada, but Alberta, I think we were looking at this morning, where Canadian Thanksgiving is earlier than United States Thanksgiving, and already in Alberta you can see since then a bit of an increase in cases. So we've got to be careful about this, but we can't do it at all if we have stubbornly high prevalence, because then any spike over Christmas would tip potentially our hospital services into a much more serious position. So these are not easy situations for us to be in, but we are not alone here. And in fact, in a UK and European context, we're perhaps not quite as badly off as some other areas. So we just need to stick with it in order to get through this winter. And what we know now is that after this winter, there are definitely brighter times ahead. Do you want to add anything?
No, I mean, I think it's just really important to continually emphasise the need for us to learn from other countries' experience as well. So that ability to be able to engage with colleagues across Europe, across the world indeed, and look to see what have they learned from their experience of dealing with this. We're very well equipped to be able to do that. We've got a number of our advisors who sit on my advisory group who have networks of influence across the globe and who are able to tap into that experience and feed it back so that we can consider how we play that into our strategy in terms of trying to deal with this. And as I say, we're very watchful of the experience, particularly across the north of America just now, as first Canada and soon the United States experience that festival period of Thanksgiving where families come together and interact with each other. Inevitably, what has happened in Canada is that there has been a real spike in cases there afterwards, and we need to be able to learn from that and to be able to respond to that. And some of that is about making sure that we do the work just now, so that if that happens for us when we come towards the Christmas and New Year period, is that it doesn't have disastrous consequences for our health service in January and February.
Vivian Aitken from the Record.
Good afternoon, First Minister. This morning, the Daily Record covered the tragic story of Margaret McKell, who was displaying symptoms of COVID-19 but couldn't get a test for 2 weeks. The system ruled that Helensburgh was a Scottish island, so refused to send out a postal test to this frail lady. Attempts to get a test nearer home proved impossible, and as neither she nor her husband drove, she could not attend the offered one at Prestwick Airport, around 56 miles away. by the time she was offered a more local testing station, she was too ill to attend, was taken into hospital and died a week later. I know the UK government run these tests, but what conversations have you had with them to correct these geographical blunders, and when will they be fixed? And also, there may be a very good reason for this, but why are the thousands of Scots Islanders denied access to these postal tests anyway? And thirdly, what advice would you give to others who may be in the same unfortunate position as Mrs. McKell?
Well, firstly, Vivian, I've read the story this morning, and, well, absolutely the first thing I want to do is convey my condolences to Margaret McKell's family, and no words can lessen their grief, but my thoughts are with them. I've asked for the circumstances of this case to be fully explored, so that I have more details of what happened and whether anything that should have happened didn't happen. As you say, the home testing kits, the delivery of those is through the UK government portal. We do have ongoing discussions with the UK government about any geographic glitches in that system, and we'll continue to do that. But what I want to understand a bit more than I do just now, so I can't go into detail about it on the basis of the information I have right now, is why Margaret didn't more quickly get offered testing through other routes. I think I read in your piece this morning that her husband was tested through his GP surgery, so it's not immediately clear to me why that wasn't offered to her as well. So I can't really go any further than that right now, because I'm waiting on further information. But if there is more that I'm able to say to you about that later today, I'll make sure we get that to you. But as I say, I do want to fully understand the circumstances, so that if there are lessons for the Scottish Government side of this, then we make sure these are learned, so that we minimise the chances of this kind of tragic set of circumstances happening again. Scott McNabb from the Scotsman.
Thank you, First Minister. On vaccines, a second candidate's emerged today, the American pharmaceutical firm Moderna, saying their vaccine is 95% effective. I'm just wondering if I could get your reaction to that, and also opposition parties suggesting that a vaccine plan should now be published by the Scottish Government on things like encouraging uptake, sites where vaccinations would take place, the role of GPs and pharmacists, etc. So how far down the line are we with that? And also, if I could go back to schools, the Chief Medical Officer suggesting earlier schools seem to be safe, not a key problem for transmission or source of infection. But we are seeing very high absentee rates in schools. What's behind that, and is anything being done to address it? Thank you.
I'll hand over to the Health Secretary and then CMO, Health Secretary on vaccine, the CMO, who might want to say a word or two about latest vaccine developments, but also anything else in schools. Firstly, there is more good news on the vaccine front today. There is the Moderna vaccine that some results of the trials have been announced in the US showing 95% effectiveness. The Moderna vaccine is one that is in the mix of the UK government's vaccine supply, although the ones that we expect to have most supply of most quickly are the Pfizer one and hopefully the AstraZeneca one. But we also see today the Janssen vaccine going into trials, and NHS Tayside are part of that in terms of recruiting people to trials. So everywhere you look just now, there is really positive, optimistic news on vaccines. You know, there are hurdles to overcome. We can't, absolutely rest on our laurels on this, but there is every reason to be really optimistic about this. Our planning in Scotland for rollout and delivery of the vaccine are well advanced. The Pfizer vaccine, without going into technical details, is quite a difficult one to distribute because of the way it comes. So that's all factored into our planning. The Health Secretary and I think Thursday afternoon last week, spent a couple of hours with our officials just going into the detail of where exactly that is. And the Health Secretary will make a statement this week in Parliament setting out more of the detail of that. And I'll hand over to her in a second. On school absence levels, the vast majority of young people are in school, and that is a big advance on earlier this year when all young people were out of schools. There will be a number of young people off school because they might have COVID symptoms. in a smaller number of cases, they may have tested positive, or they may be isolating. Now, nobody wants to see young people being off school if that can be avoided, but at the moment, we are managing to see the vast majority of young people in school, and that's what we're trying to protect and continue. But I'll hand over maybe to Gregor first on any of that he wants to comment on, and then to Jeane, who will give a bit more on vaccine.
So let's talk about the school pupils first of all, because obviously it's something that we continue to kind of track and make sure that we're keeping abreast of the data in relation to school absences just now. The majority of those school absences, the rise that you speak about, are caused by the increased number of children, school-aged children, who are isolating as a result of contact, mainly with household members who have tested positive. And we can actually drill down a little bit further to see that it's actually only 1.2% of those absences which are explained directly by COVID illness itself, and that's 0.1% of the school-age population as well. So these are very small numbers that we see. It's inevitable, because of the transmission rates that we're seeing in some communities, that some pupils will have to isolate because of other members of their household or people they've had contact with. As I say, I am not surprised by the type of data that you've spoken about there just now. In terms of the vaccines just now, I think that we're at a really exciting phase of development. As we've spoken about for some time, there are literally dozens of vaccine projects which are active across the world just now. We're getting to a point in time where many of those will begin to start reporting their findings. The news today from the United States is only one of a number that I suspect will come through over the coming weeks. These should give us signs of real optimism that vaccines will offer a scientific means by which we can exit this pandemic. I would hope that over time what we will see is more and more of these vaccines proven in the research basis, and that they can be actively moved to a kind of delivery phase. I think it's really important that we continue our research in this area. We shouldn't rest on our laurels with this vaccine development. I'm delighted to hear that there's another major vaccine research trial which is starting across the UK with Centre up in Tayside as well, where Scottish patients will be contributing to that to that research as well. It's really important that we continue to develop a pipeline of more vaccines over time, so that if there are any changes which begin to develop with the virus itself, we are able and in a position to be able to respond to that.
Thanks very much. So we've been planning for some time in the hope of vaccines getting through the clinical trials and being approved to run a national vaccination programme for all adults in Scotland. So that's about 4.5 million people. I hope I will be able to set out, subject to Parliament agreeing, the plan this week to Parliament. Now, that plan will cover, as best we can, our estimated timeline for delivery, and it is estimated at this point until we're sure exactly when different levels of supply of the vaccine are going to come to us. We've got an agreement, a four-nation agreement around the procurement of vaccines and then their distribution. The plan will also set out who will be vaccinated first, taking the guidance of the Joint Committee on Vaccines and Immunisation, and also the various places where people will be able to get their vaccine, and how we will let folks know when their appointments are coming up. And those places will be a mix of large vaccine hubs where we can put through large numbers of people, but also more localised and perhaps mobile vaccination centres, particularly for our remote and rural communities, but also for those communities not necessarily in remote or rural areas, but in our urban areas where it is easier for people to get to a local centre to be vaccinated than it is to go through a large drive-through or walk-through. The other thing I would say about all of this is that the other thing that we will do is set out very clearly and consistently a lot of public information, not only about the plan and what to expect and when they should hear about their own vaccination timeline, if you like, when they should expect to get an appointment, but also all the steps that go through vaccinations in order to ensure that they are safe and that they do the job we need them to do and they do not harm. because I think it is really important that people understand the importance of this vaccine, the benefits of it, and are assured by all the information we can give them, that clinicians can give them, about the safety of that. I was speaking to our Royal Academies at the latter end of last week about precisely that and what role they can and want to play in order to provide that assurance. And just this morning I was speaking to one of our Health Board chief execs on a number of things, but on this too, just to check that from their point of view, they were as ready as they can be to deliver their end of the vaccination programme, and they are. We're just waiting to be absolutely certain about the dates when we can kick it off and get going.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. John Swinney said yesterday that some people are failing to comply with the rules by continuing to visit each other's homes, and suggested that this was contributing to virus levels staying stubbornly high. How would moving to level 4 in any area address this? Because surely people who are flouting this rule would just continue to do so. And also, you said earlier that you need to ensure hospital capacity is not breached. What is the current hospital bed and ICU capacity across Scotland?
The capacity, I don't have the figures in front of me, but we have the ability to double ICU capacity. We have the ability to then treble it if necessary up to 750 ICU beds. We are nowhere near that. We've got 98 in ICU with COVID right now. I think this is the figure I don't have in front of me in precise form, but there'll be around 200 people overall in ICU at the moment. So we're not near breaching that right now. Similarly, hospital bed occupancy across the NHS right now, this will vary, obviously, health board to health board, hospital to hospital, but hospital bed occupancy is around 85% or thereabouts. Gregor's telling me 84%. So, and we have in hospital just over around 1,100 patients. Remember, at the peak in the spring, at any one time, I think it was 1,500 were in hospital with COVID. So we're not at that yet, but we're not complacent about that. So right now, we are satisfied we have the hospital capacity we need, but obviously we model and project forwards. And that is part of the decision making about whether we need to take more action now, given that hospital and ICU admissions are a lag in the life cycle of this virus, whether we need to take more action now to avoid breaching any of that capacity in any area later on. I think the first part of your question, and I think it's kind of, you've got to be careful not to get a bit kind of mix up these things. You know, going to level 4 is not about trying to persuade more people to abide by the household restrictions. We want to do that anyway. That is what we're asking people across the country to do right now, not go into each other's houses. Compliance there, I think, is probably very high, but like anything else, there will be some people for whatever reason who are not complying, and that's why every day we stand here and say, please don't breach these rules, because every time one of us does it, we put other people at risk and we undermine our overall efforts. Going to level 4 is an indication that in a particular area, the level 3 restrictions, even with reasonable compliance with them, is not sufficient to drive infection levels down. So these are not, it's not as simple as saying because people aren't complying with one restriction in one level, then that is what is taking us to another level. There is a broader range of issues at stake there. Alistair Grant from the Herald.
Hi there, thanks very much. You've pointed to those areas that could be put into level 4 restrictions, such as in the Greater Glasgow and Clyde Health Board area. Could you give some guidance on the areas where trends suggest it's likely that they might be able to go down a level, as you suggested earlier on? And I was also just wondering what the latest thinking was on whether mandatory enforceable travel restrictions will be needed. And are we likely to see them introduced this week alongside the move to level 4 in some areas? Thanks.
On different areas and levels, I'm not going to speculate beyond what I said earlier on. I don't think we'll see significant numbers of councils going down a level, but maybe one or thereabouts. Obviously, the kind of areas I pointed to last week were more in the east of the country, East Lothian, for example, but we haven't taken decisions on that any more than we've taken the final decisions on level 4 yet. Clearly, if you go to level 4, then the the necessity of travel restrictions, which are necessary to support any regional tiered approach, become even more necessary. So yes, a part of our consideration today is whether we need to, in order to make very clear to people how important it is that they abide by these travel restrictions, whether any level 4 move would be accompanied by a more statutory regulation-based approach to travel restrictions. Rachel Watson from the Daily Mail.
Thank you, First Minister. Can I just follow up on the travel restriction question there? If these travel restrictions were to become legally enforceable, would that just be for level 4 or would that be for level 3 areas as well? And also just on areas that could move into level 4, will level 4 look the same for every area if different areas are moved into it? For example, could you guarantee that schools would remain open in all council areas, or could some schools look at blended learning, or would there be any other differences?
No, level 4 is likely to look the same. I've always been cautious about giving guarantees in the context of a global pandemic, which I think is wise and is treating people like the adults they are. But I couldn't be clearer about the intention and the objective of keeping schools open for all the reasons we've set out. I don't think there's any more I can usefully say on travel restrictions. I'll cover that in my statement tomorrow. Richard Percival from the Daily Express.
Thank you, First Minister. Just on the restrictions, I know obviously Boris Johnson sort of set a timeline for when they'll be lifted. Obviously in England it's December the 2nd. Have you sort of got any indication, say, if level 4 restrictions are imposed in certain council areas, so when they'll be lifted, say, in 10 days, 14 days? And secondly, just looking at the latest government testing data, it sort of shows that Scotland's done 20% less testing per capita than England. I think the figures show that Scotland did 445 per 1,000 population, and England did 539, and just some opposition parties are saying that's too limited and underutilised. I'm just wondering what your thoughts on that were. Thank you.
I'm going to come on to that point directly, because if ever there was a wrong way of looking at something, that is it. But on the first part of your question, I'll set out the detail of what we do tomorrow when we do it. I think I've gone into a lot of, for all the reasons I've set out, I've gone into a lot of detail about our thinking, but in terms of the precise detail, we will set that out tomorrow. Remember that, so we are looking now at expanding mass testing using different technology than the PCR testing that we've been using so far. But in terms of the PCR testing, remember that the key strand, or one of the key strands of that through the UK-wide Lighthouse Lab, it's demand-led. It's testing for people who have symptoms. So the reason Scotland has done less of that than other parts of the UK is because we have had slightly fewer people with symptoms, because the prevalence of the virus in Scotland has been lower. So actually, while we shouldn't be complacent, we shouldn't rest on our laurels with this, that's actually a good thing, not a bad thing. If we'd done lots more symptomatic testing, that would mean we had lots more people with symptoms because we had higher levels of the virus. So just every now and again, people should remember that sometimes these comparisons don't quite actually tell you what you might hope that they tell you. Sometimes they can actually be, relatively speaking, good news rather than bad news. And lastly, Greg Russell from The National. Oh, no, I am told Greg is not with us, which takes us to the end of the questions. Thanks very much for joining us. Thanks to Jeane and Gregor, and to Jill for our BSL interpretation, and as always to the journalists. Thank you to you for joining us today. I will join you tomorrow from the Scottish Parliament. My update tomorrow will be from there, and because it's in Parliament, it will be at a later time tomorrow, so there'll be no 12:15 briefing. My statement in Parliament will be, I think, around about 2:20, but I'll make sure some information on the precise timing of that goes on Twitter over the course of tomorrow morning. In the meantime, please stick to all of the rules. It's really important, whatever level your area is in now or might be in later in this week, the most important thing is we all stick to the rules that apply in our area. Every time one of us just twists them or tries to push them to breaking point or breaches them, we undermine what we're all trying to do. So please stick to these rules, and in particular, remember not to get into each other's houses unless you're on the islands, and remember facts, which are the 5 things, if we all do and stick to rigidly, we really do help to stop this virus spreading. So my thanks to all of you today. I will see you from the Scottish Parliament tomorrow and back here at 12:15 on Wednesday. Thanks very much.